16 minutes past 8, ITV is dedicating today to celebrating and saying thank you to the NHS workers who are tackling coronavirus on the front line.
We're joined now by two of those heroes, Elaine Clancy, the chief nurse at Croydon Health Service, who is responsible for managing the Trust's response to COVID-19, and Maureen Brannan, who coordinates a team of 300 cleaners working for the NHS in and around Rotherham. Well, good morning to both of you. Let's talk to Elaine first. Elaine, you're with a lot of your fellow NHS heroes going into this battle every day. What's it been like for you?
It's been a journey, but, you know, the team have been fantastic. We all work together, supporting each other, and the camaraderie and teamwork is fantastic.
How have you increased your capacity there? Because one of the main messages we get is that the reason that we're staying at home is to protect the NHS, to allow the NHS to be able to cope. You're right there in charge of organising services at hospitals. What have you done there in order to make sure that the NHS can cope?
So we've tripled our capacity for critical care to ensure that patients get the right treatment that they require in critical care. And we've stopped some of our routine work and we've changed the way we work. So outpatient appointments and consultations with consultants and doctors we've done using technology that we haven't used before to prevent people from coming to the hospital, to free up capacity and free up staff to be able to treat those patients with COVID-19 who require our attention.
How tough has it been, this added pressure of family members not being able to be with their loved ones as they fight for their lives or die? That added cruelty, it seems to many people. It must be really hard for you guys because you're having to talk on the phone, I guess, all the time to the relatives rather than having any personal contact.
Yeah, it's very tough. It must be incredibly tough for families and relatives, and it's tough for the staff as well because we're used to working with families and relatives for patients. We've had an incredible donation of iPads and phones that our staff have been able to use with patients so that they can talk to our loved ones. And we've set up a next of kin telephone line that some of our staff are using so that patients can phone there and talk to a member of staff and get some details and updates.
And Elaine, of course, you know, that video calling is so important, that contact is so important, but also what's so important is that as well as the normal care you would give patients, you are effectively their sort of substitute family right now, aren't you, where their family can't come in to visit. You are the ones who need to hold their hands at the lowest moments.
That's right, and that's difficult, but that's what nurses do all the time. We care for people and have we're very privileged to have a very special relationship with our patients. And that's probably intensified now without families and relatives being able to visit. But that's what we're trained to do, and that's what the team are doing.
Yeah. Well, let's bring in Maureen Brannan, because there's so many different types of heroes on this frontline battle. Cleaning of the hospitals and of the care homes, everything is incredibly important. You are up in Rotherham. How hard has it been to be cleaning when you have this deadly virus everywhere you're going?
From my point of view, we've got a number of staff who are quite knowledgeable and multi-skilled, so we provide them with training and understanding regarding how to clean in these types of areas. So that has been so helpful from our organisation point of view. They've actually been forward-thinking, and as soon as the coronavirus started, provided training so that we...
How protected are your staff? I mean, do they feel adequately protected? They're as at risk, I would think, going into COVID wards as any of the nurses or doctors.
Yeah, we've been fortunate for PPE. We've had adequate supplies. And like I say, it's training, knowing about your enemy, which is coronavirus, how it'll attack you, what armour to put on, what ammunition, such as cleaning products, so that we can decontaminate all areas. So it's a safe environment for medical staff and patients so that they can carry on with their work.
Elaine Clancy, we clap for carers, of course, on a Thursday evening at 8 o'clock. What does that moment mean for you?
It's quite emotional, actually. Seeing the support of the local public, it's really quite overwhelming, and it can be quite emotional actually on a Thursday evening. Last week, our local police colleagues, who we work closely with anyway, were all outside the front of our accident and emergency entrance with their blue lights on and clapping, and it's really quite touching, and it means a lot to the teams.
What do you guys make of Captain Tom Moore and his £12 million fundraising and rising by the thousands every minute?
Maureen?
He's an inspiration to the country. What can be done?
Absolutely right. And Elaine?
Yeah, he's absolutely incredible. He's phenomenal. We're all watching him. And before we came on, we were talking today about he's just brilliant.
Are we all agreed he should get a knighthood?
Absolutely.
Yeah.
Sir Tom, it's got to happen, hasn't it?
Yeah, absolutely.
Look, you are all heroes. Elaine Clancy, thank you very much indeed, from Croydon University Hospital, centre of my universe, frankly, Croydon. So thank you very much indeed to all. You're all heroes. And Maureen, I hope your staff know as well that although they sometimes have been treated as invisible, that cleaners are right there on the front line, heroes as well, saving lives. You know, we couldn't get through this without you. So a huge thank you to you as well. And when we clap for carers, we're clapping for cleaners as well. Thank you both. Thank you all.
Thank you very much.
Thank you very much indeed.
Well, ITV is proud to be supporting the NHS Charities Together 1 Million Claps campaign. Here's how you can get involved.
To send a message of support to the NHS and donate £5, text CLAP and your message to 70507. Your message can be passed on to your local hospital and the donation will go to the